Hi guys! Today I will be doing my presentation over a behavioral health public hearing that I had the opportunity to listen in on and that I found super interesting. Originally, the experiential experience I had chosen for this assignment was going to be me sitting in on a meeting held by the Iowa Board of Nursing, but on the day that I had originally intended on going, no one had showed up to it. So I'm assuming it got canceled. So I chose this instead because I'm really big into behavioral health and mental health care. And I also just feel like this meeting was more beneficial to my learning as a future nurse leader, and as it had showed the legislative side of healthcare and how we as healthcare leaders can and should get involved with it. So on July 8th of 2024, this meeting was held, and there were a total of 499 participants who were actively in attendance this day. Unfortunately, I was not able to attend this meeting in person on the day of the meeting, but thankfully, due to COVID, lots of things like this are recorded and uploaded onto the internet now. Which is great because I honestly felt like this meeting was probably one of the best things I could do for this project, and would have hated to have gone to something less interesting or boring, or something that I wouldn't have had much to present on. So I'm glad I chose this one. It was also just relevant to nursing leadership specifically, and is something that is a current issue in Iowa, or at least a more recent issue that I feel is pertinent for all of us to know and learn about. So before I really dive into this project presentation, I just wanted to take a moment to add this into my presentation for anyone who may be currently facing issues with their own mental or behavioral health, in case this topic brings about anything triggering for some people. So if you or someone you know is struggling with their mental health, you can reach out for help by calling or texting 988 to access the Suicide and Crisis Lifeline. That said, let's get into the presentation. So what is behavioral health? Behavioral health refers to a few things, according to this meeting. It means mental health, addictive disorders, life stressors, and crises. They are health disorders, just like any other health disorder, that are common and treatable. And finally, behavioral health care refers to a full spectrum of prevention, early intervention, treatment, recovery support, and crises care. Behavioral health is important as it has a major impact on our overall health and well-being, how we feel from day to day, and it can affect how long we might live. In Iowa, there are 600,000 people, or 1 in 5 adults, who have a diagnosed mental illness. Of these, 37,000 have a serious mental health illness. And this is why behavioral health has become a major topic of discussion in recent legislation within Iowa, and what this meeting was all about. HF 2673, Behavioral Health Pathways, was a piece of landmark legislation passed in Iowa by Governor Reynolds on May 15th of this year. It is a bill that aligns Iowa's 32 disconnected mental health and substance abuse regions into 7 unified behavioral health districts to improve outcomes for Iowans. Through alignment, the hope is that Iowa will create consistent pathways for accessing services, use existing funding more effectively towards intended outcomes, and help to streamline administrative work. The vision for behavioral health in Iowa includes, again, a system with clear access points, Iowans having access to services and support no matter where they live, and the elimination of administrative red tape that currently prevents Iowans from receiving the care that they need. They also help to link federal, state, and local governance and authority alongside linking funding to measurable system outcomes. They plan on achieving the goals we discussed in the last slide through a shared responsibility model. This model will include 3 entities: the Iowa Department of Health and Human Services, the lead entity, which are administrative services organizations, and local providers, which, side note, these are all also entities that definitely should have been in attendance during this meeting. With HHS, their role is to develop service definitions and standards, reporting requirements, and performance outcomes. They are also responsible for developing the service system's state plan and approving of district plans. Additionally, they will help with administrative funding to the lead entities. The lead entities, then, will develop and implement district-wide plans to ensure adequate service provision in every county within the district. They are responsible for ensuring service quality and performance outcomes and collaborate with and report to the HHS and other district lead entities regarding the service system and progress towards intended outcomes. They also contract with local providers and provide them with training and technical assistance as needed. Then, lastly, local providers may include a few different groups of people: substance use prevention and treatment providers, law enforcement agencies, mental health providers, and so on and so forth. They are the ones on the front lines who provide the activities and services according to the lead entity's district plan. They collaborate with the lead entity and other local providers to ensure service provision within every county in the district and report progress and outcome data to the district lead entity. And this is what their implementation timeline looks like. According to one source, the implementation process for something like this typically takes between 3 to 5 years. So I would say that this is a fairly appropriate and realistic timeline for the state to get everything done. The hope is that everything will be pretty set in stone by July of 2026, and then they'll continue to take it from there and make adjustments to the plan along the way as needed. So how exactly then does this affect current practice? According to Governor Reynolds, this act will align Iowa's 32 separate mental health and substance use service regions into one unified behavioral health system. She stated that by bringing services together in this way, we will be able to better enable the coordination of care, supporting the best possible outcomes for each individual. It's what Iowans deserve and what we intend to deliver. Each of the new districts would be governed by their own state-appointed entity, either a public or private group, and advised by a 10-person council of elected officials, local constituents, health professionals, and law enforcement. The aim of this new system will be for equitable statewide access to behavioral health care with stronger local connections. And lastly, the bill would repeal several boards and commissions, including the state's Commission on Aging, which serves as the policy-making body for programs serving senior Iowans, replacing it with a new Council on Health and Human Services. At the end of the meeting, they asked the audience to provide their comments on 4 final questions. The first 2 here were what considerations, funding, workforce, provider capacity, etc., are more important for planning behavioral health district boundaries? And 2, do any of the proposed district options reflect community needs and resources? Why or why not? And the last 2 questions were, are there any areas or communities that should be in a different district than in any of the proposed district options? Why? And then lastly, what is essential to a smooth transition to a new system design that maximizes resources and minimizes disruptions to care? It was during this point in time that participants had the opportunity to share their opinions on the then proposed bill, and where I was able to see what types of participants were in the audience this day. So, of the 499 people that I know for sure were in attendance this day were the state senator from Ames, a worker for the Department of Health and Human Services in the Behavioral Health and Disabilities Department, a parent with a child who has mental health struggles and a mental health waiver, a community partner with the Division of Tobacco, a retired psychiatrist, a school mental health services worker in eastern Iowa, a worker with new opportunities in western Iowa alongside their behavioral health director, an advocate for Pure Run Support Services, the president and CEO of YSS, the CEO of CICS, and the CEO for Vera French Mental Health Center in eastern Iowa, a worker from a community action agency in northeast Iowa, a state senate candidate representing Story and Marshall counties in Iowa, the senior vice president of operations with Trivian Life Services, mothers, and other normal individuals from the community. And lastly, there was also a pediatric nurse practitioner from rural southeast Iowa who was in attendance this day, which I found to be the most interesting of all of the participants who attended this meeting and offered their thoughts and opinions on the bill. She was also the chair of the advisory committee to the Mahasi region, which is the current region in southeast Iowa. In her response to these questions, she advocated for there needing to be a separation in children's and adolescents' mental health services from adult mental health services, and stated that voices of children need to be at the table as it was essential for a smooth transition into this new system. So, knowledge gained. I learned that nurse practitioners can act as leaders in legislation by actively advocating for healthcare policies that improve patient access to care, particularly by leveraging their clinical experience or expertise to inform lawmakers about the real-world impact of proposed legislation on patient care and patient outcomes. Nurse practitioners, as we learned here today, can influence legislation by lobbying, testifying at hearings, partaking in grassroots organizing, policy research, and serving on advisory boards, as the nurse practitioner who we spoke of in my last slide does. And then that's it. As always, if anyone has any questions, please feel free to reach out to me by responding to this post, emailing me, or texting me at the email and number I've provided here. Here are my resources, and that's the end of my presentation. I hope you all enjoyed. Thank you. Have a good day, guys. Bye.